as symbols of national identity go. Public healthcare's wallet-sized ID card is pretty prosaic. But when I recently asked you if public healthcare defines Canada, your answers were anything but. A campus of the Ottawa Hospital. Ian Austin, New York Times. The question was prompted by a visit to Toronto by Margot Sanger-Katz, a health policy reporter in the Times Washington bureau. She had tagged along with Senator Bernie Sanders, who took a field trip to look at Canada's healthcare system. As a visiting American, Ms. Sanger-Katz was particularly struck by one thing. Time and again, people in the healthcare system and patients used the word fairness when discussing it. The overwhelming consensus of Canada letter readers, at least based on your emails, was twofold. Despite its flaws and regional variations, public health care is generally a key to defining Canada. And for many of you, it reflects a more collective spirit lacking in the United States, particularly now. Though, of course, not everyone agreed. Tommy Douglas, a pioneer in public health, speaking as Premier of Saskatchewan in 1959. Express newspapers, via Getty Images. Many of your emails mentioned how the system owed its existence to Tommy Douglas, the Baptist minister who, as Premier of Saskatchewan, introduced the first provincial healthcare program in 1947. Mr. Douglas, as many of you also noted, was the father of the actress Shirley Douglas and grandfather of Kiefer Sutherland, who plays an accidental president of the United States in the television thriller Designated Survivor. Mr. Douglas may have pioneered public healthcare, but he never saw his dream of a socialist Canada realized. The party he once led, the New Democrats, has never held power federally. And a liberal government made universal healthcare a national reality in 1966. Few, if any, politicians within the mainstream spectrum would dare suggest ending it today, although calls for reforming its services, which are delivered by the provinces, and its funding have become the perpetual motion machine of Canadian politics. Space doesn't allow me to include all of your responses, but here are some of the highlights, which have been condensed and edited for clarity. Defining values. It is all about fairness. Canadians believe that every citizen has a right to the same services and privileges as everyone else, and the same responsibilities as every other citizen. The latter is less often expressed, but is part of the fabric of our society. We have worked very hard as a society to ameliorate or eliminate disparities as much as possible, across a vast landscape with a sparse population. Universal health care is one of those measures. Jane Mattei, Calgary, Alberta. Setting us apart. We do see our healthcare system as a defining feature of our society, but as with many of the things we see as integral to our own self-image, multiculturalism, bilingualism, peacekeeping, gun restrictions, the monarchy, we choose to identify with it mainly because it sets us apart from the USA. Remember, in the context of developed countries, the Canadian healthcare system is pretty unremarkable. It is the US that swims against the current. John Ringer, from Toronto, currently living in Britain. Paramedics with a patient at the emergency department of the civic campus of the Ottawa Hospital. Ian Austin, New York Times. Diverging paths. The Canadian and American health systems did not diverge greatly in the first part of the 20th century. Some Canadians and some Americans shared enthusiasms for public power, a graduated income tax and government-based health care. They included many doctors on both sides of the border, especially those who, in the 1930s, were tired of being paid in chickens and bacon. The first federal project was concocted during the war, though it remained on the shelf. There was another flare-up in 19456 with plans for an Ottawa and social welfare system, and the health part probably resembled Harry Truman's medical care project. Canadian and American schemes for universal healthcare strongly resembled each other. But the Canadian one was enacted, while the American was only partially realized. Robert Bothwell, professor of history, the University of Toronto. Ideological divider. People say that the border between Canada and the US is artificial and the people are the same on both sides. But Canadians have evolved differently, with a sense of fairness and equality that is not seen south of the border. It may date back to our founding. The motto of the US, life, liberty and the pursuit of happiness, stresses individuality, while Canada's constitution talks about peace, order and good government, stressing a belief in the government that the US doesn't seem to have. Eric Cohen, Toronto. Community versus profit. There is a collectivist sentiment here that emphasizes equity and interpersonal decency, frequently manifested as Canadian politeness, one that supersedes the highly entrepreneurial approach that healthcare has long had in the US. This is reflected in every step of the system, including the lack of private medical schools and universities. The health system attempts, with considerable success, to make collective health the goal, rather than emphasizing the intervention-heavy, irrational life-prolonging at all costs marketplace that is available to the select cadre of Americans who can afford it. Dr. Erica Frank, Professor of Public Health, University of British Columbia, Vancouver. Global Times. The Reader Center is the place to go with your story ideas, questions and feedback about the Times coverage. In turn, it's also a forum for us to fill you in on how and why we do things. Right now the Reader Center is looking for questions about how we cover the news for our international readers and, generally, what else those readers would like to see from us. Canadians make up the biggest chunk of our international audience. So I'm hoping that many of you will use this form to submit your questions and observations. Answering your questions will be Jody Rudoran, the editorial director of NYT Global, whose task is to find ways to improve the relevance of the Times to readers outside of the United States. Those efforts include our expanded coverage of Canada and this newsletter. And the editors at the Reader Center also want to hear from Canadians for whom the recent sexual harassment accusations have prompted frank discussions with parents or grandparents. On that topic, I highly recommend reading this story about the shifts in the discussion of sexual harassment by Jessica Bennett, who recently came to the Times as its gender editor. Center Ice, Tony Harris, an artist in Ottawa, has spent the past year painting portraits of hockey players who have been deemed to be the sport's 100 best. The portraits will be open to public viewing free of charge Saturday and Sunday afternoon at the Bell Center in Montreal. Alex Ovechkin is, unusually, a favorite son in both Washington and Moscow. But Mr. Ovechkin's embrace of a group supporting President Vladimir V. Putin of Russia is making some of his American fans uncomfortable. TransCanada. Paul Shehui has long stood out among the wealthy Chinese immigrants in Vancouver, British Columbia, for his political connections. But now HE's noteworthy for another reason. Dan Levin reports that the British Columbia authorities have accused Mr. E of bilking investors of millions of dollars, promising them access to Canadian residency. Mr. Levin also spoke with CKNW Radio on Friday about the fraud. Vancouver hopes to free up some apartments and ease its chronic housing shortage with new limits on Airbnb rentals. The effectiveness of its new law, however, is being questioned. The Daily 360 took its cameras to Iqaluit, Nunavut, and into the studio of the jeweler Matthew Nuchinyak. A native of Windsor, Ontario, Ian Austin was educated in Toronto, lives in Ottawa and has reported about Canada for the New York Times for over a decade. Follow him on Twitter at @IanRalston. Tell us what you think at nightcanada@nighttimes.com. And, using the link above, please subscribe to the email newsletter version.